This is part 5 of the urinary system lecture. Want to start off by discussing some risk factors associated with kidney disorder. Um, there, what'll put you at risk for kidney disease or disorders, working in a chemical or an toxin environment in your job, contact sports. Diabetes mellitus, that's type 2. Family history of any renal disease, frequent urinary tract infections, heart failure, high sodium diet, hypertension, certain medications, polycystic kidney disease, um, kidney injury as a result of some type of trauma, motor vehicle accident, fall, sports-related injury, trauma, um, and polycystic kidney disease. Oh, that's in there twice. Huh, okay. All right. So in your textbook, the first common disorder with the urinary system is analgesic nephropathy. And taking Tylenol, ibuprofen, acetaminophen on a daily basis for over a long period of time can cause chronic kidney problems. That's why it's called analgesic nephropathy. Um, Also, certain combinations of painkillers, aspirin, Tylenol, with or without caffeine or codeine, can likely harm your kidneys as well. Um, so some signs and symptoms of analgesic nephropathy include blood in the urine, which is hematuria, increase in urination frequency or urgency, pain in the kidney area. It's typically in the back or but it can be painful one side or both sides. A decrease in urine output, decreased alertness, drowsiness, confusion, lethargy, numbness and tingling, arms and legs, nausea and vomiting, widespread edema, easy bruising. Makes sense because, again, we're talking about aspirin and naproxen, ibuprofen. It's diagnosed by blood pressure checks. Urine toxicology screen would show a high level of painkillers in the urine. Urinalysis, a complete blood count, a examination of any tissue that's passed in the urine. This would probably require a 24-hour urine collection would be very helpful as well. An IV palleogram, which is a series of x-rays of the kidneys, ureter, and bladder. It does require contrast dye to be injected, and this also can help find kidney stones, tumors, abnormalities as well. All right, so treatment options. I did some little research on this, not a lot of information. However, several of them did list stopping taking all over-the-counter pain medicine. So that would, if you're truly in a lot of pain, then that would mean you'd have to maybe go to a pain management clinic for help with that. Also, dietary changes, low sodium diet, avoid, fatty food, greasy food, low fat diet. So medicine, like I said, really couldn't find a good run on what type of medicine you would take for this. So behavioral changes help, again, with controlling chronic pain. Again, those pain clinics do a lot of good for several people. Treatment to prevent any further kidney damage as well. Oh, also with the dietary changes, increase in fluids may be an option as well. All right, chronic kidney disease. Chronic kidney disease is just what it sounds. Chronic, meaning you've had it for 6 months or more. It's very slow, gradual process. And of course it's irreversible loss of kidney function, and they determine kidney function with what's called the GFR, which is a glomerular filtration rate, and that's of course it's a blood test. Helps show how well the kidneys are functioning by estimating how much blood passes through the glomerule every minute. Of course, I'm sure the higher the numbers, the better. I looked up there are chronic kidney disease that comes in stages. You have mild, moderate, severe, and then it leads into end-stage kidney disease. And so with at risk, normal kidney function, you'll have greater than 90 milliliters of blood flow per minute. With mild, you have 60 to 89 milliliters of blood flow every minute. As it moves into the moderate stages, there'll be 30 to 59%. Severe is 15 to 29 milliliters per minute, and end stage is less than 15 milliliters per minute. Again, it's gradual. Let's see. Hypervolemia can occur because of the kidney's inability to get rid of the sodium in the water. Also, hypovolemia can occur because the kidneys cannot conserve water and sodium. The chronic kidney disease will affect all major body systems, and of course may require dialysis or kidney transplant to maintain life. Chronic kidney disease is primarily caused by diabetes, hypertension, chronic urinary obstruction, kidney stones, tumor, recurrent infection, renal artery occlusion, occlusion of the renal artery, and also an autoimmune disorder can contribute to it. Data collection, of course, is going to be history, signs and symptoms, history of the disease. Also, we'll need to monitor not just the physical body, but also the psychological body, because this can be very emotional, hard for patients to deal with, and they may have depression, anxiety, denial, changes in body image as well, especially if they have to go on one of the two types of dialysis. Interventions, it would include good diet changes, of course, low sodium especially, moderate protein. So you don't, and moderate protein because you don't want to decrease, the moderate protein would help to decrease the workload on the kidneys. You would want some high carbohydrates, low potassium, and low phosphorus in the diet. Also, provide oral care. These patients can have frequent mouth sores, which can be very painful. Skin care to prevent pruritus or itching. Kids decline about fluid and dietary restrictions. Importance of daily weight. Fluid restrictions, because if the kidneys aren't functioning properly, we can't just drink, as much as we used to. Oftentimes these clients will have a fluid restriction of anywhere from 500 to 1,000, 1,200 milliliters of fluid per day in an effort to reduce the workload on the kidneys. We'll also, the daily weights will help determine if they're gaining too much weight. If they're on dialysis, they will gain weight as right after dialysis up until the time when they go to their next treatment. Typically, they'll weigh them before they put them on the dialysis, and again weigh them afterwards as well to see. Also, as nurses, we want to promote their acceptance of what's going on and include them in the planning for the next steps, what's to come. Some patients, depending on age, may decline dialysis. I have seen that before in a lady who was in her 80s. Was a nursing home client, and after she declined dialysis, they did put her on some medication to kind of keep her diuresed, but she didn't last more than a week, I believe, in that type of situation. Some problems with kidney disease, activity intolerance, which leads to fatigue. They can have problems with anemia. They'll need rest periods as well. Teach the client to plan activities to avoid fatigue. You as a nurse, when you go and visit them, try to cluster your care. Try to complete several tasks at one time, and then give them some time to rest. Also, anemia can be a problem because we remember the kidneys can sense when the red blood cells are low, and they secrete the epoetin to stimulate the bone marrow to start making more red blood cells. And if they're in dialysis, they may also need that injection. I'm not sure if it's monthly or once a week, but I do know the minimum would be monthly. Lots of signs and symptoms related to chronic kidney disease, neurological wise. They could have seizures. They could have a bit hard time concentrating, slurred speech, ataxia, cardiovascular wise, hypertension, of course, heart failure, peripheral edema, respiratory wise, they may have shortness of breath, pulmonary edema, could have pleural effusions, hear crackles when you're listening to them. Well, let's see, we already talked about hematological anemia. They may also have abnormal bleeding or bruising. GI-wise, they may have anorexia, nausea and vomiting, constipation, or diarrhea. Urinary-wise, proteinuria, hematuria, polyuria, nocturia. Skin-wise, decreased skin turgor, dusky gray color to them, dry skin that is itchy. They may have purpura. Musculoskeletal, muscles will be weak. They may feel cramps. Bone pain is common. Reproductive, decreased fertility, impotence, decreased libido. Some other things to consider: GI bleeding, hyperkalemia, a lot of electrolyte imbalances, of course. Let's see. Infection is very common. Also, metabolic acidosis is common as well. And let's see, let's list the stages on this slide as well, with percentages in disorder of the glomerular filtration rate. You also see a diminished size of the kidney as well. Handout also suggests also managing and controlling cholesterol. And again, treatment is peritoneal dialysis, hemodialysis, or transplant. All right, the next slide should have been about diabetic nephropathy. Well, I guess I don't have a slide for that one. It's due to high glucose levels, interfere with the balance of blood. The kidneys work really hard to get rid of the excess glucose. Peeing it off is one way to get rid of it. And of course, over time, that breaks down the filter. And so the glucose gets through the filter and starts showing up in the urine. And that is, again, that's damage to that filter. Breaks down the kidney tissue, the kidney function deteriorates. And then that's why also, that we have to watch, especially as we get older, blood sugar levels. Your physicians in your 40s will start checking blood sugar levels, all your cholesterol levels, to keep you on a better path. Some signs and symptoms of the diabetic nephropathy: thirst, fatigue, anemia, weight loss, frequent urinary tract infections. Some nursing interventions would include keeping control of the blood pressure and blood sugar, monitor vital signs, I's and O's, monitor the BUN and creatinine, and also urine albumin levels, restrict dietary protein, sodium, and potassium. You also make sure any physician, anyone that prescribing medication needs to know that you have kidney issues, because some medications can be nephrotoxic. This again can also lead to dialysis or may need transplant as well. Let's see, moving on. Our next one is glomerular nephritis. Glomerular nephritis is an umbrella term for a group of kidney disorders characterized by inflammation, injuries to the glomerulus. It results in inflammatory changes with the glomerular structure. There can be destruction, inflammation of the glomerulus, and it can be both, usually as both kidneys. Inflammation results in an antigen-antibody reaction produced by infection elsewhere in the body, and it progresses and you can have loss of kidney function develops. It's caused by immunological diseases, autoimmune disorders, Group A, streptococcus, and history of pharyngitis or tonsillitis for 2 to 3 weeks. You have acute, which lasts 2 to 3 weeks, and then there's chronic. That's after the acute phase, it can slowly continues over time. Complications with the glomerular nephritis. I have to look at it to say it's crazy. Complications can be kidney failure, of course, hypertension, seizures, pulmonary edema, and heart failure. Nursing interventions would include vital signs, daily weights, I's and O's. And again, with the daily weights should always be at the same time of day and the same type of clothing. dietary restrictions of sodium, monitor for complications, which could be seizures, pulmonary edema, heart failure. Also, these patients will take diuretics, antihypertensive meds, antibiotics. Um, And your handout, your textbook tells us that most common causes are bacterial infections. All right, urinary tract infections. Um, Urinary tract infections, you may also hear them called cystitis, cystitis, and that's inflammation of the bladder from an infection or obstruction of the urethra or some type of irritant. Most often the cause is Enterobacter, Pseudomonas, and E. coli. Cystitis, of course, is more common in women because our urethras are shorter, and urethra in the woman is located very close to the rectum. With education, we need to make sure we're educating people to wipe from front to back. Also, at our nursing homes, it's another reason why it's so important with our nursing home patients to keep them checked frequently. I cannot tell you how many times, and I did work nursing home, but how many times I helped clean up a client that had been sitting for an undetermined amount of time in their own stool due to incontinence, and they, wearing a brief, and nobody checks them, then they get to sit in it, and it's no wonder increasing, that causes urinary tract infection. So this slide I have here kind of gives you the path of your pathogen, how it gets in and makes its way up to the kidneys and can cause acute kidney injury over time. Some signs and symptoms, we may see frequency or urgency, burning with urination, uh, being able to only void just a small little bit or not able to void. They may not be able to completely empty their bladder. Urine may be very strong, could have blood in it. The client will have chills and fever. They may also get very nauseated and vomit as well. Remember, confusion is the primary first sign you'll see with a nursing home patient, elderly person, because all of the waste products are not leaving the body. Some nursing interventions to go along with UTI would be to administer prescribed antibiotics. And also, once the full antibiotics are done, have them checked again for the UTI to make sure it's completely gone. Physicians can also prescribe an antispasmodic that will help calm the bladder and make it easier for them to void. We'll also want to increase fluids unless that's contraindicated. If they have heart failure, it would be. Let's see. Also, if you have to put a Foley in, make sure you're using sterile technique. Also, when we're trying to get a urine sample, oftentimes when we suspect a UTI in an elderly person, we can do a little in and out and get a urine sample. And always remember, this is sterile, 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 because we definitely don't want to give them something um, from breaking sterile field. Discourage any caffeine, such as coffee and tea and cokes. Avoid alcohol. Take all their medicine as prescribed. Get it rechecked. A repeat urinalysis and culture after treatment to make sure it's completely gone. All right, that ends part 5, and we'll hopefully wind it up here in a little bit with part 6.